अस्सलाम वालेकुम स्टूडेंट्स। तो आज हम डिस्कस करते हैं एपिडेमियोलॉजी ऑफ द न्यूप्लेसिया. So the epidemiology of cancer is the study about the cancer and the people, and epidemiology is used to determine the cause of the cancer, and similarly it is also used to find the occurrence or the frequency of cancer in the people, and similarly it is also used to determine the distribution of the cancer with respect to the place, person and time. इसका मतलब ये है कि कौन सी टाइम पे, कौन सी जगह में, किन किस्म के लोगों में किस टाइप का कैंसर ज़्यादा कॉमन है. And a person means that whether the people that are affected are either of younger age, older age, or they are adult people. And similarly, the epidemiology is used to determine the contributing factors toward the carcinoma. And the epidemiology includes, the first one is the incidence of the cancer. Incidence means the number of new cases of the cancer occurring in a specific people in a specific area within a specific time. Similarly, the incidence also include the global impact of the cancer on the people, and which kind of cancer is common and which kind of the gender, whether it is common in the male or in female. Like in males, the prostate carcinoma is more common. Similarly, lung cancer and the colon cancer are also common in the male, but in female, the breast cancer is more common. And the incidence also tell us about the mortality ratio. So the most common cancer which causes death in both the male and the female is the lung cancer. So the lung cancer has a high mortality ratio. So the second one is geographical distribution. Geographical distribution means that the incidence of certain cancers are common in certain specific areas. Like in Japan, the incidence of the gastric carcinoma is high and its mortality ratio is 7 times higher than the US. But in US, the breast cancer is more common and its mortality ratio is 4 to 5 times higher than Japan. So the third one is the environmental factors. So there are multiple environmental factors which leads to the carcinoma, and its significance is to identify these factors and to avoid them to help in reducing the occurrence or the prevalence of these cancers. And the environmental factors include diet, alcohol consumption, smoking, obesity, exposure to UV light, and the reproductive history. So the first one is the diet. So the diet that is highly rich in the fats and proteins and have low quantity of the fiber, they lead to the colonic cancer. Second one is the alcohol consumption. So the alcohol consumption is associated with the increasing risk of various cancers, like it causes carcinoma, oropharynx, laryngeal cancer, esophageal cancer, liver carcinomas, gastric carcinomas, and the pancreatic cancer. So the third one is the smoking. Smoking increases the risk of the multiple cancers in the body, like lung cancer is most commonly caused due to the smoking. Similarly, the laryngeal carcinoma, hepatobiliary carcinoma, breast cancers, endometrial cancers, transitional cell carcinoma of the bladder, and the prostatic carcinoma, most of them are caused due to the smoking. The fourth one is the obesity. So obesity is also associated with the increasing risk of certain cancers like ovarian cancers and the breast cancer. Similarly, 14% of the cancer death in the male and 20% of the cancer death in women are associated with the obesity. The fifth one is exposure to the UV light. So the exposure to UV light increases the risk of the certain skin malignancies like squamous cell carcinoma of the skin, basal cell carcinoma of the skin, and the malignant melanoma. The sixth one is the reproductive history. So the prolonged exposure to the estrogen that is unopposed by the progesterone, they increases the risk of the endometrial cancers and the breast cancer. And the reproductive history also include early menarche, late menopause, prolonged reproductive life, functional ovarian syndrome, nulliparity, hormone replacement therapy, use of oral contraceptives, and multiple sexual partners. All of these contribute towards the cancers. So next one is the environmental carcinogens. They include medications like methotrexate, exposure to the UV light from the sun, and the well water having the heavy elements like arsenic, mercury, or the radioactive elements like uranium, polonium. They lead to the various cancers. Similarly, the working places like working in the lead industry or the asbestos industry, they causes occupation-related carcinomas. The lung cancer occur because of the arsenic compound, asbestos, beryllium compound, nickel, and the radon gases. And the benzene compound exposure to this benzenic compound leads towards the acute myeloid leukemia. Similarly, the cadmium compounds are related with the prostatic carcinoma. Next is the age. Age is an important risk factor for the various cancers, and most of the cancer occur within the old age. In male, the cancers are common within the 60 to 79 years of age, and in female, the cancers are more common within 40 to 79 years of age, and the incidence of cancer increases with the age. It is because of the increase in the accumulation of somatic mutations within the cell, and similarly there is a decrease in the immunocompetency in the old age people, which leads toward the carcinomas. But the cancer are also common within the children's, and in the children's most of these cancers are inherited, and they are associated with the germline mutation, and they are rarely acquired. Like in children's, the acute leukemias are common, Williams tumor of the kidney, rhabdomyosarcomas, retinoblastoma, tumor of the retina, and neuroblastoma. All of these cancers are common within the children. The next is the predisposing factors. So the predisposing factors include all the factors which make a person more prone towards the cancer, and these predisposing factors include chronic inflammation, precursor lesion, and the immunodeficiency. All of these three factors they lead towards the cancer. So the first one is the chronic inflammation. So the chronic inflammation makes the land more fertile for the development of the cancer. अगर हम example ले लें chronic gastritis की, so the chronic gastritis it remains for a longer time, it leads toward the gastric carcinoma. And the chronic inflammation causes a cancer because the chronic inflammation increases the cellular proliferation to compensate for the tissue damage, and this increase in cellular proliferation makes the fertile ground for the cancer. Similarly, the chronic inflammation also increases the pool of the stem cell within the tissue, and these stem cells are more prone towards the malignant transformation. And similarly, the chronic inflammation activates the immune cell, and this immune cell then produces the reactive oxygen species, and this reactive oxygen species causes damage to the DNA, which leads toward the neoplastic changes. The second one is the precursor lesion. So the precursor lesions also causes neoplastic changes, and these precursor lesion causes localized morphological and the functional changes within the parenchyma of the tissues, which increases the risk of development of the carcinomas. And these precursor lesions include hyperplasia. So if there is a hyperplasia of the endometrium, which is a complex endometrial hyperplasia, they increases the risk of endometrial cancer. Second one is the metaplasia. In Barrett esophagus, the squamous epithelium is replaced by columnar epithelium, and if the Barrett esophagus remains for a long time, it leads to the esophageal cancer. Similarly, the intestinal metaplasia of the stomach leads to the gastric carcinoma. Similarly, there is a squamous metaplasia of the bronchi due to the chronic smoking, which increases the risk of the bronchial cancer. And the last one is the dysplastic changes, like that occurs in the cervical intraepithelial neoplasia. It is a precursor lesion, and it may lead to the carcinoma of the cervix. So the third one is the immunodeficiency. So the patient that are immunodeficient, particularly those having the T cell deficiency, they are more prone towards the increasing risk of various carcinomas, like the carcinoma that occur due to the oncogenic viruses like human papilloma virus, which is associated with the cervical carcinomas. The last one is the genetic predisposition to the cancer. So the heredity can also influence the cancer associated with the environmental factors, and they include the sporadic cancers and the hereditary cancers. So sporadic cancers contribute toward 95% of the cancer, and these sporadic cancers occur because of the environmental factors or the acquired predisposing factors, and most of the sporadic cancers are autosomal recessive. Autosomal recessive means that these cancer will express if there is mutation in both the alleles occur. If one allele is functional, then this cancer will not occur. The second one is the hereditary cancer. So around about 5 to 10% of the cancers are associated with the germline mutation, and these cancers are most common in the younger age, and these cancers are usually autosomal dominant. Autosomal dominant means that this cancer will express if there is mutation in one allele of the gene occur. If the one allele become mutated and the second allele is normal, still they will express. Dominant means that this cancer will express if there is mutation in the single allele of a gene occur.